Welcome to part 2 of our comprehensive series on Medicare enrollment periods. In today's video, we are going to move on from original Medicare, and instead we are going to teach you about the different enrollment periods for Medicare Advantage, Part D plans, as well as Medigap plans. Understanding these enrollment periods is essential as they determine when you can enroll in, change, or disenroll from these different plans. It is all about timing, and getting it right or wrong can significantly impact your healthcare coverage and peace of mind. As brokers at Giardini Medicare, our job is just as much about helping people understand when they can enroll in these coverages as it is finding the right coverage to actually enroll in. In addition to today's video, you can also now access a full list of our educational Medicare resources and get free personalized one-on-one guidance by going to our website, doineedmedicare.com. Before discussing these different enrollment periods, if you are new to Medicare or you just need a refresher on the basics of Medicare Advantage, Part D coverage, as well as Medicare supplements, I highly recommend watching this video that explains the key details between the differences between Medicare Advantage and Medigap plans in under 10 minutes. Now let's start with the initial enrollment period, which is sometimes called the initial election period, but either way it is abbreviated as the IEP. Now the IEP, it applies to both applying for original Medicare Part A and Part B, like we talked about in our previous video, but it does also apply to Medicare Advantage and Part D coverage. This enrollment period is a crucial first step for many people entering the Medicare landscape for the first time. It aligns with your 65th birthday, consisting of the 3 months before the month you turn 65, includes the month you turn 65, and continues for 3 months after the month you turn 65. So for example, if your birthday is in June, your IEP would start in March and end in September. But of course, there is an interesting twist. If you were born on the first day of the month, your IEP, it shifts 1 month earlier. So for a March 1st birthday, it would actually be easier in your mind to pretend that your birthday was in February, since in this case, your IEP, it would actually occur from November through May, and you would be eligible for Medicare Advantage or Part D coverage effective February 1st. Now, the timing of your enrollment within this period will also affect when your coverage starts, making it important to time correctly. Enrolling during the 3 months before the month you turn 65, this will result in your Medicare Advantage or Part D coverage becoming effective the first day of the month you turn 65. However, if you wait to apply during the month you turn 65 or during those 3 final months of your IEP, your Medicare Advantage or Part D coverage, it will begin the first day of the month following your application, even if you try to select a different effective date when applying. When it comes to many enrollment periods, it is good to know that the actual enrollment period is not fully used until the plan becomes effective, as you can see from the Medicare guidelines. The same is true for your initial enrollment period. So let's say you turn 65 on August 19th and you use your IEP to enroll in May for a Medicare Advantage plan to become effective August 1st when your Part A and Part B also become effective. But then you change your mind and you want to cancel that original plan and enroll in a different Medicare Advantage plan or even a Medigap plan and Part D coverage instead. You can still make this change using your IEP before your original plan becomes effective on August 1st. Just make sure to connect with a broker to navigate any unique situations like these. However, in that situation, if you were to have waited until the month of August when your Medicare Advantage plan actually went into effect and then you change your mind, you can no longer use that initial enrollment period to make a change, since once your plan is actually effective, the enrollment period is considered to be used. Although this does not mean that there are not other enrollment periods to make a change, which we will mention very shortly. Last but not least, if you are eligible for Medicare before age 65 due to disability or other qualifying conditions, as you approach your 65th birth month, you will then have a unique opportunity for a second initial enrollment period to change Medicare Advantage or Part D coverage. So at that point, you will essentially be treated like anybody else turning 65 and enrolling in Medicare for the first time. If you use this opportunity to change your coverage, just know the effective date at the earliest would be the first day of the month you turn 65. Now we will move on to the annual election period, or AEP. This is often called open enrollment. However, we really try to avoid calling it that for reasons we will discuss later. Luckily for you, it is easy to recognize when this enrollment period is approaching, since your mail will be filled with more junk than usual, and Medicare commercials and spam phone calls will interrupt your peaceful nights at home.
The final roast tonight.
It's me again.
So I guess we should say, unluckily, you'll know when it's approaching. This annual election period, it occurs from October 15th to December 7th, and it happens each year. If you enroll in new coverage during this time frame, your new plan will take effect on January 1st of the following year, regardless of when you actually applied during the AEP. Now, during AEP, you can switch from one Part D plan to another, or you can change from one Medicare Advantage plan to another. You can also move from original Medicare with Medigap and Part D coverage to a Medicare Advantage plan as an alternative to original Medicare. And finally, vice versa, you can also disenroll from Medicare Advantage coverage to return to original Medicare with or without Part D coverage and a Medicare supplement. Although keep in mind, your ability to enroll in a Medigap plan, it is still going to depend on your ability to pass medical underwriting and qualify for a plan based on your health. We will highlight this more when discussing Medigap enrollment periods towards the end of this video. An important concept to remember during AEP is what brokers commonly refer to as the last application in wins. This means if you apply for a new plan and then you find a better option before the end of December 7th, the last plan you apply for will be the one that takes effect in January. So for example, let's say that James applies for a new Medicare Advantage plan in late October, but he discovers a Medicare Advantage plan that he likes better in November, and he decides to apply for that instead. In this case, the Advantage plan he applies for in November will become his new plan effective January 1st. Just know if you do apply for multiple plans in the same day, the first application successfully processed by Medicare will be the one that takes effect, so please try to avoid this. Now let's delve into special enrollment periods, or SEPs. These are a critical aspect of Medicare that offers enrollment flexibility under specific circumstances. SEPs, they allow you to make changes to your Medicare Advantage and Part D plans outside of the usual enrollment periods, but they are triggered by specific life events typically. Understanding SEPs can significantly impact your ability to maintain the most suitable coverage and most cost-effective coverage year-round. We will highlight some examples of special enrollment periods now, but just know that there are dozens of different special enrollment periods for both Medicare Advantage and Part D coverage, making it so there are far too many to discuss in detail in this video. So of course, instead, we will link to a source with more details about virtually all of the possible SEPs that may be available to you based on many different situations. One common SEP arises when you are losing employer or union health coverage, which also includes retiree coverage and COBRA coverage. This special enrollment period to enroll in Medicare Advantage or Part D coverage, it exists while you are enrolled in employer coverage, and it ends 2 months after the month your coverage ends. So, for example, John is retiring and losing his employer health insurance at the end of June, and he needs Part D coverage on July 1st to go with his Medigap plan. This SEP would allow him to choose an effective date for his coverage up to 3 months after he completes the application, so he can enroll in Part D coverage in April, May, or June for a July 1st effective date to avoid unnecessary gaps in coverage. However, if for some reason he does not proactively enroll in coverage, he would still have through August, which is 2 months after the month his employer coverage ends. Now, another noteworthy SEP is for enrolling in a plan with a 5-star rating. Each year, Medicare evaluates plans based on quality and performance, and a plan that achieves a 5-star rating represents the highest possible rating. So, from December 8th to November 30th of the following year, you have the opportunity to switch to a 5-star Medicare Advantage or Part D plan if one is available in your county. But just know this SEP can only be used once per year, and to find if there are 5-star rated plans available in your county, you can do so by using the Medicare.gov Plan Finder tool, and then when you're in there, you can sort by the star rating. Just be aware, in recent years, 5-star rated Part D plans have been very uncommon and non-existent in many states, although you may have better luck finding a 5-star Medicare Advantage plan. Overall, special enrollment periods are designed to ensure that your Medicare coverage can adapt with you as your life changes, whether it's a move, a loss of coverage, coverage, a change in your financial situation, or even a natural disaster, SEPs provide a safety net allowing you to make necessary adjustments to your healthcare coverage. We will provide a link in the description below this video in case you need to discuss any potential SEPs with a broker licensed in your state. In addition to the different enrollment periods we have discussed, which generally apply to both Medicare Advantage and Part D plans, there are also unique enrollment opportunities specifically for Medicare Advantage plans. These periods are designed to offer additional flexibility to ensure that your Medicare Advantage plan continues to meet your needs, and we will explore these right now. First, we have the Medicare Advantage Open Enrollment Period, or MAOEP, which runs from January 1st through March 31st each year. During this time, if you are already enrolled in a Medicare Advantage plan, you have the option to switch to another Medicare Advantage plan or disenroll from that Medicare Advantage plan entirely, and you can return to original Medicare with or without Part D coverage and a Medigap plan. However, again, you do have to qualify for that Medigap coverage, typically based on your health. It's important to note that this period, it does not allow for changes to standalone Part D prescription drug plans, meaning you can't go from one Part D plan to another Part D plan during this enrollment period, and you can also not use this enrollment period to switch from original Medicare with a Medigap plan to a Medicare Advantage plan. Plan changes using the Medicare Advantage OEP are effective the first day of the month following your enrollment request. So for example, Steve is enrolled in a Medicare Advantage plan, but in February he wants to change to a different Medicare Advantage plan. He then uses his Medicare Advantage OEP to apply for a new Medicare Advantage plan in February with a March 1st effective date. In addition to the timing, it is also crucial to know that this enrollment period can only be used one time per year, and overall, it can just be thought of as a way to give Medicare Advantage enrollees one more opportunity to reassess their coverage after the fall annual election period has ended. Hopefully someday they will do the same for Part D, but unfortunately that has not happened yet. Now let's talk about a lesser known Medicare Advantage open enrollment period, which is sometimes called the OEP New. This enrollment period, it does not occur during a set time of year like the one we just talked about, and instead this period applies to individuals who are newly entitled to both Medicare Part A and Part B, either because you have just turned 65 or because you recently enrolled in Medicare Part B for the first time after age 65. This enrollment period lasts during the first 3 months of being enrolled in both Medicare Part A and Part B. Here are some examples to bring this enrollment period to life. We have Shelly, who turned 65 on February 4th and enrolled in a Medicare Advantage plan effective February 1st using her initial enrollment period that we discussed earlier. Now, in this case, her unique Medicare Advantage OEP New, it would occur from February through April. And in March, Shelly, she ends up changing her mind and wants to enroll in a Medigap plan with Part D coverage instead. Since Shelly can no longer use her IEP, instead she can use her OEP New to disenroll from her Medicare Advantage plan to return to original Medicare, also enrolling in Medigap and Part D coverage beginning April 1st. However, those of you that delay your Part B enrollment past age 65, you may also be able to have access to this OEP New enrollment period. For example, we will look briefly at David, who at age 67 enrolled in Medicare Part B for the first time using his Medicare Part B special enrollment period that we talked about in our previous video, and he did this with an August 1st effective date. At that time, he also enrolled in a Medicare Advantage plan effective for August 1st, using what is known as his initial coverage election period, which we will discuss next. In this case, David's OEP New would last from August through October, giving him the chance to either change Medicare Advantage plans or return to original Medicare with or without Medigap and Part D coverage. Again, this enrollment period, it is for those enrolled in a Medicare Advantage plan, and it does not apply to changing from one Part D plan to another Part D plan. Last but not least, we have the initial coverage election period, or the ICEP. Now this period is particularly important for those of you that delay enrollment in Medicare Part B beyond when you're first eligible at age 65. The ICEP is the period during which you can first sign up for a Medicare Advantage plan coinciding with your enrollment in Medicare Part B. So when you delay Medicare Part B, this enrollment period, it occurs during the 3 months prior to the effective date for your Part B coverage. Like always, here is a brief example to make a little bit more sense of the ICEP. Again, we will use David from our previous example. David used his Part B special enrollment period to enroll in Part B of Medicare effective August 1st at age 67. But he still wanted a Medicare Advantage plan for August 1st, so he needed an enrollment period to do so. David can no longer use his initial enrollment period since he has passed the 7-month window that surrounds his 65th birthday. So instead, he can use his ICEP. In this case, his ICEP, it occurs during the 3 months before his Part B effective date, which would be May through July, and if he enrolls in a Medicare Advantage plan during this time period, that coverage would begin August 1st to match his Part B effective date. So whether you are adjusting to new circumstances or simply seeking a plan that better suits your current needs, understanding these different unique Medicare Advantage enrollment periods will be the key to helping you get the coverage that you want. But now moving on from Medicare Advantage and Part D plans, let's end by turning our attention to Medigap plans, also known as Medicare supplements, and the nuances of their enrollment periods. Unlike Medicare Advantage and Part D plans, Medigap plans, they have their own set of rules for when and how you can enroll in these plans. The most critical period to be aware of is your Medigap open enrollment period, or Medigap OEP. According to the official Choosing a Medigap policy guidebook, this period begins the first month you are both 65 or older and enrolled in Medicare Part B for the first time, and it lasts for 6 months. During this enrollment period, you can enroll in any Medigap plan you're eligible for without being denied or charged higher premiums based on medical underwriting and pre-existing health conditions. Continuing our theme of using examples, here are a couple other ones to better understand the Medigap open enrollment period. So first, we have John, who turned 65 on September 9th, and he enrolls in Medicare Part A and Part B effective September 1st using his initial enrollment period. His Medigap open enrollment period would also occur from September through February, allowing him 6 months to choose a Medigap plan without health-based restrictions. Now, he wisely applies for his Medigap plan in advance in June for a September 1st start date using his Medigap OEP, and then he secures Part D coverage effective September 1st using his Part D IEP. Now, Craig, on the other hand, he kept his employer coverage past age 65, then he retired at age 68 and enrolled in Medicare Part B starting May 1st using his Part B special enrollment period that we discussed in the previous video. In this case, his Medigap OEP, it occurs from May to October. So despite being 68, Craig also gets the same benefits of the Medigap OEP just like John did. Additionally, he was able to enroll in Part D coverage effective May 1st using his Part D SEP for leaving employer coverage. Now, here are a couple pro tips you should be aware of when it comes to your Medigap OEP. First, you can apply for your Medigap coverage using your OEP before your Part B coverage is actually effective. Many companies will also let you apply for Medigap coverage 6 months before your Part B effective date, even if you don't have your Medicare ID number yet. Although this doesn't actually make your Medigap coverage begin any sooner, it does let you get your coverage in place to avoid last-minute stress and issues. Also, although we don't suggest going overboard with this, you can change your Medigap plan multiple times if you would like while your Medigap OEP lasts. Outside of your Medigap open enrollment period, Medigap plans are unique in the fact that they generally don't have set enrollment periods. Instead, you can apply for Medigap coverage 365 days of the year, and yes, 366 if it's a leap year. However, this comes with the very important caveat that you have to be able to qualify for the new Medigap plan based on your health and pre-existing conditions in most states and circumstances. This is done through the process known as medical underwriting, which the official Choosing a Medigap guidebook defines as the process an insurance company uses to decide based on your medical history whether to take your application for insurance, whether to add a waiting period for pre-existing conditions, and how much to charge you for that insurance. These underwriting restrictions also apply during the fall annual election period, which again is why we don't like referring to it as open enrollment. However, of course, there are states that have unique rules when it comes to changing Medigap coverage, so if you live in one of these states on the screen, make sure to connect with a broker who is familiar with the unique Medigap rules in your specific state. And even if you're not in one of those states, it's always good to connect with a broker to see if there are unique situations. Also, as you can see on Medicare.gov, there are different qualifying events that may give you guaranteed issue rights to enroll in Medigap plans without health questions and pre-existing condition exclusions. We are not going to highlight each one of these right now, but we will link to the details you can see here on the screen in the description below. Last but not least, although Medigap enrollment is available year-round for those that qualify for it, just know that if you are currently enrolled in a Medicare Advantage plan, you will likely have to wait for a specific enrollment period like the ones we discussed earlier in this video if you do want to disenroll from your Medicare Advantage coverage and enroll in a proper Part D plan to go with your Medigap coverage. So overall, navigating Medicare can be complex, but you don't have to go it alone. If today's discussion has sparked questions or if you're seeking personalized guidance, please make sure to comment any questions below, subscribe to our channel for future videos, and you can also use the link in the description to connect with an independent broker licensed in your state.